Thanks for stopping by my new YouTube channel. I'm a doctor that works in Canada, and I wanted to create a YouTube channel to talk about the most common questions I get asked in a family medicine context. And this first session I wanted to devote to IUDs because contraception is something I talk about a lot with my patients, and I realize that there's a lot of misconceptions out there, especially concerning IUDs for young girls. Let me tell you how I came up with this idea. So I had a young patient scheduled with me, and it was to insert an IUD. At the time, I was hoping to get a little bit of a refresher. So where else do I go other than YouTube to see if there's any like medically sponsored videos that I can quickly take a look at and see if I can, just go over the things I need to go over. So I'm looking, and I spend about 5 minutes looking through all the videos on YouTube about IUDs and, insertion and all these things. And I'm not a very good searcher, or, I was literally just yielding people's accounts, well, harrowing accounts of what happened when they had an IUD inserted, or what, most people feel are the negative side effects of IUDs. And most of the videos were talking about like how they rot inside of your body, or how once you get an IUD you can never get pregnant again. So I was very surprised, and I thought that, why not have another opinion out there too, so people can make an informed choice as well. So here I go. What are IUDs? IUDs stand for intrauterine device, which means exactly that. It's a tiny little device about this big, with little wings, that goes inside the uterus. And the uterus is about, it's about the size of your fist. Okay, so it's about that big, and essentially it goes kind of inside that, and it just stays there, and it can stay there for up to 5 years, 3 years depending on the device, 5 years, or 10 years depending on which device you get. Now, what kinds of devices are there? There's two types generally. There's one with a hormone and one without a hormone, so just copper. Okay, and who is able to get these devices inside? Well, basically any young female who wants to prevent a pregnancy. And like I said, they prevent pregnancies. They don't prevent sexually transmitted illness, so that's something to be aware of. Okay, and at the insertion, the doctor usually does a screening as to whether or not somebody already has one of these sexually transmitted illnesses. And if they do, they'll probably either treat that infection first, or they'll do the insertion and then treat them afterwards. Okay, but essentially there's two types of IUDs, one with a hormone, one without. Whichever one is right for you, you'll have to discuss with your provider. Okay, usually people who have a really heavy cramping and really heavy periods do not want the copper one, because that problem can actually become worse. And people who actually, have really heavy bleeding and lots of cramping may benefit from the one with the hormone. So it might be a better option. A lot of the times I get a lot of women asking me, like, what does it feel like when, and how much pain is involved when we put it in? So long story short, it isn't painless, but it's not at all the worst pain ever in the world. Okay, so after I insert them, I always ask my patients, how bad was that really? And usually I get a, on a scale from 1 to 10, for like, 10 seconds it was a 7, but generally it averages out to like a 4 on 10. Okay, so it's not that bad. I mean, it's not a walk in the park, but it's not the worst thing in the world. And the whole thing, the whole insertion should probably take about 5 to 10 minutes. Okay, so it's not horribly long. The doctor is going to use a speculum, so something that you put inside to hold the vagina walls open, and then we basically use an instrument to hold the cervix. That's usually what causes a little bit of cramping because we have to kind of clamp it in place, and then we basically just insert the device. It doesn't take a long time, okay? And you can get it inserted at any time in the month. In fact, if you've never had a child, then probably during your period is the best time. My patients always ask me about the ick factor. It does not at all affect me, so don't be worried, don't be shy, okay? Your doctor has seen it all. This isn't the first time that we've done it, so don't worry about that, okay? So if your doctor is recommending to come during your period, come during your period. It actually makes it a bit easier because the cervix itself, which is the opening to the uterus, is a little bit more open, which makes sense to make the blood flow out, right? What happens after it's inserted? Basically, we just cut the strings about, you know, a few centimeters long, and no one should be able to feel the strings. It's not like a tampon string where it hangs outside. These strings stay within you, so nobody can really feel them. And if it becomes a problem, and you know, somebody can feel them, then basically we can just cut them a bit shorter, okay? So that's basically the insertion, which I feel like a lot of women come to my office wondering exactly how is this going to feel. Always take note that it's probably advisable to take acetaminophen or ibuprofen or naproxen before the insertion, so up to half an hour before. So ask your doctor about how much you should take, and even after, because after you can get a little bit of cramping too, okay? What you should watch out for is that, you know, there's no foolproof method of protecting yourself against pregnancy. So you should always be aware that there's always a slight chance that you could still get pregnant even if you followed everything, you know, and you just, sometimes it happens. So if you feel that you're pregnant, even with the IUD inside, go to your doctor right away, because sometimes that pregnancy can be in the wrong place. Like, it's not, because the egg won't be able to usually implant in the uterus, so it might implant in the tubes. So that you would really want to know sooner than later. It's a medical emergency and you would have to like go to your doctor right away, okay? But the chances of that are very small. And also sometimes the IUD can be pushed out by the uterus. Sometimes you just get so much cramping. The IUD comes out. You'll feel it though. You'll feel the plastic. You'll feel it probably coming out. Usually. So if you're having major cramping, go see your doctor again, okay? And if obviously you're having a fever after a few days of having it inserted, go see your doctor right away too, okay? So those are sort of the things you need to be aware of. But generally speaking, I mean, IUDs are such a great invention. It really takes the memory work out of contraception, so you don't have to remember to take a pill every day at the same time, or you know, you don't really have to keep track of it. It sort of stays internal, it's hidden, it's inside, and you really just have to, you know, if and when you decide that you want to have children, it's basically a short visit to the doctor again, either the family medical doctor or the gynecologist, and they basically just pull on the strings, it comes out, and that really isn't painful at all. And then your fertility, if it was a copper IUD, it returns to normal fertility like right away. And if it was an IUD with a bit of hormone in it, then it can take maybe 1 or 2 cycles on average before you can probably have a successful pregnancy. So that's my spiel on IUDs. I hope it wasn't too boring. I hope it wasn't too long. And if you have any questions, please let me know. Yeah, and I hope to upload another video soon about another question I get asked. Have a good day. Bye.